so let's talk a little bit about consent. Okay, consent. Okay, so today's session is not really so much on consent. We will cover more of it in the next round of our workshop. But I still wanted to cover this briefly. Okay, so under the Singapore Penal Code, anybody under the age of 16 is not able to give consent to any sexual activities. So in a nutshell, very simple, don't be confused with the law. Just remember, anybody below 16, don't engage with them sexually. Okay, and you will have a bigger punishment if the person is under 14. Okay, so just remember, in Singapore, age of consent is above 16. And here are some basic framework guidelines around consent. Yes means yes. If they say yes, okay. But if you feel that they're saying yes and then it's not a genuine yes, you're not sure, ask. Okay, silence. The person is not really like very happy about it. They are just quiet. Okay, if you're not sure, it means no. If they're saying maybe, it means no. Consent can be withdrawn at any time. Okay, they can change their mind. Consent is explicit. Okay, as far as possible, try to get explicit consent. Sometimes it's not explicit, sometimes it's hinted, like the person takes your hand and touch their hair or something. That means they want their hair to be stroked. So sometimes consent is not explicit. It can be verbal or non-verbal. Coercion is not consent. When you're threatening someone, when you're making them feel bad and say, oh, you better be my girlfriend or else, okay, that is not consent. Repeating and nagging and pestering someone is not consent. Drunk people cannot give consent. People sleeping cannot give consent. People underage cannot give consent. Okay, consent is without any pressure, without any like threat. They are freely and willingly given. Okay, so this is a picture of a cake showing different, in a nutshell, a summary of consent. Consent is freely given, it's informed, is enthusiastic. They're very, very happy about it. Oh, let's go and eat cake. They're very happy about it. Very specific. So consent is reversible. It's clearly communicated. Everybody involved is equal parties, not bully the person to, you know, do this thing. And it's an ongoing conversation. Okay, it can change over time. Okay, so this is a picture. I know it's very aggressive languaging, but it's very powerful. In this picture, it says women don't owe you shit. Okay, women don't owe you a text, they don't owe you apology, they don't owe you a reason, they don't owe you prettiness, not politeness, not a response, not a date, not a shag, which means sex, not a shag, not a hello, not forgiveness, not femininity, not compliance, not anything. I think this is very important message because society puts onto us, especially women, that we need to be good girls and good boys. We need to please people. We need to obey our parents. We need to respect our elders. And then we need to be friendly. We need to this, we need to that. However, when it comes to sex, please, 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 please take care of yourself. If something doesn't feel good, if someone is making you feel uncomfortable and making you feel scared, you need to know this person is not good for you. Okay, so many times when I was younger, I could not figure out, like, you know, all this attention and all this like people trying to manipulate you. Okay, end of the day, you need to face yourself. You live with yourself. You need to live with yourself for the rest of your life. The person that you need to take care of, besides all the people around you, is actually yourself. If you are not okay, you cannot take care of other people in a positive way. And taking care of yourself is very important, regardless of abilities or disabilities. And as you know, more people with disabilities do get abused. And so it's really important that you don't let other people make you feel bad about who you are. Okay? Very strong message. Okay, now I'm going to go into sexually transmitted infections. This is a chart to show different types of sexually transmitted infections. So out of all of these, can you tell me which one of these on this chart has no cure? Okay, there's syphilis, herpes, human papilloma virus, genital warts, scabies, hepatitis B, trichomonas, chlamydia, gonorrhea, HIV, AIDS, pubic lice. Okay, most of them have a cure except HIV. HIV, no cure. Okay, no cure doesn't mean cannot survive, because there's antiviral medication they can take. So what's the difference between HIV and AIDS? HIV is the virus. Okay, you can take the medication, then the virus will be under control. But if the virus goes haywire, then it goes out of control, then it will develop into full-blown AIDS. So that's the difference between HIV and AIDS. Herpes has no cure. Human papillomavirus has no cure. Okay, human papillomavirus, you can take the vaccine, okay, that actually prevents about 70 to 80% of the most common human papillomavirus. You know, it's just like our COVID, right? They developed the Delta, right? And the Mu, right? Don't know all the different strands of the COVID. So human papillomavirus is the same. They have different strands. And the most common ones, you can get a vaccine for it. Okay, and this vaccine applies to men or women. Okay, so what happens with the human papillomavirus is that you get the virus, and then the virus will show up in your body in the form of warts, okay, like cauliflower growth on your body. So sometimes it will drop off and sometimes it will not drop off. Then you have to laser it off. But there is no cure. There is no cure once you catch the human papillomavirus. So just now I mentioned human papillomavirus can actually also be in your throat, be in your mouth. So that is the reason why oral sex is not safe sex as well. So don't be scared about all these viruses, okay? Because I am actually a very, very sex positive person. And I don't really like talking about the bad or ugly side of sex. But it is really important to get yourself educated so that when you come across these terms, you know what is treatable and what is not treatable. Okay, chlamydia, gonorrhea, syphilis, they are actually very common sexually transmitted infections. All of them have cure. And this trichomonas, I tell you, I have gotten this many, many times. Okay, so like yeast infection, you know, like bacterial infection in the vagina. I get this very, very common because my body is very sensitive to any introduction of bacteria. So anytime your body seems to be releasing a discharge, a liquid that is not normal, you usually don't have it, it's good to go for a checkup. Okay, so usually what the doctors will do is they will just give you antibiotics. It's completely treatable. Okay, if you are catching a bacterial infection. Yeah, so even your diet can play a part in the smell and the discharge that you have. Okay, now I'm talking about people with vaginas. Okay, so so these are some of them. Just be familiar with the names so that when the doctor mentions these conditions, you don't freak out for nothing. There's a cure. Okay, so once again, chlamydia, gonorrhea, human papillomavirus, no cure, herpes, no cure. Okay, but no cure doesn't mean it's a death sentence. Okay, they can be controlled. They can be controlled. Syphilis, okay, candida, very common. Okay, trichomonas, yes. So then they have actually a window period. So what this means is when you have sex, it takes time for the virus to develop in your body. Very similar to COVID, you know, COVID needs about 2 weeks. That's why people are going into quarantine for 2 weeks, right? To make sure that they don't have the virus. So the effects, the symptoms will only show up after some time. So this is just a guideline, okay, of the window period of the different conditions. Okay, now I'm going to talk about contraception. And this is a diagram of the different types of contraception as a fun thing to look at, fun thing. But you can see very soon that actually they are not so common. Okay, so what are they? Different types of contraception. The first one is a combined pill. So it's the person with the vagina will take this to control the hormones. Then there's another pill called the mini pill. Okay, it's just different kinds of pills to control the hormones. Then there's the vaginal ring. So what happens is you put this ring on your cervix. Your cervix is at the end of your vagina, at the entrance to the womb. And they put this vaginal ring there. It releases hormones. So again, it makes the body think that you're pregnant. So if you're pregnant, you cannot get pregnant again. And then there's coils. So they use IUS or IUD. So this actually sits inside the cervix. They have to actually measure it. It goes into the cervix. So it's like a copper. So these coppers will irritate your womb. So it makes it difficult for you to get pregnant. And then there's implant. So they plant something into your body to make you not be able to get pregnant. And then there's injection. So all the things that I mentioned so far are for people with vaginas. And then there's the diaphragm and the cap. So what happens is you put this, it looks a bit like a cup. So what happens is you put this against your cervix so that the sperm cannot swim up the cervix. And then there's patch. So you put this sticker, plaster-like thing onto yourself, and it will release the hormone through the month. And the next one is internal condom. Okay, so just now I mentioned there's external condom, which is the male condom as we call it. This goes over the penis. So that is also a form of very common contraception. And then this one, internal condom. This is unfortunately in Singapore, there's no demand, so they don't really sell it in Singapore. But in the US, they actually know about this. This condom, you can actually put into the vagina or the anus before sex. So it just sits inside, you go on your date, whatever. And then when your partner is ready, even without being erect, your partner can just go in. So it actually is quite a big thing. It doesn't need to be with an erect penis. So the advantage of this is that when you have a partner who has difficulties with his erection, because that's what the external condom is. First, you have to be erect, then you put the condom over. But what if the person cannot get erect or has difficulty sustaining the erection? Then the condom is not so effective. So this is when the internal condom acts as a form of barrier. So it sounds fantastic. Like, why are we not having this demand of internal condom in Singapore, right? So I can tell you why. Because it doesn't feel good. It feels exactly like the external condom. It is very big. It feels like this plastic bag kind of a thing inside. And it is actually more expensive than the external condom, the male condom. So the internal condom is more expensive than the male condom. So anyway, I'm just going through all these so that if you ever, travel, you ever go overseas, at least you know that these are the things that are available, and then you can check out the internal condom. Who knows, maybe then you may decide to try them when you're sexual with your partner. But at the very least, you know about them. Okay, so this is a graph to show the differences. And contraception, right, is not just all the devices that I mentioned. Now I'm doing a recap. So natural way, what is natural way? That means you don't use anything to prevent getting pregnant. Okay, the natural way, first one, the safest sex is abstinence. Don't have sex with anyone, just by yourself. That's abstinence. Like with COVID, a lot of people are abstaining because they don't want to have exposure to people who may have COVID. Then the next one is coitus interruptus, which actually is what I mentioned just now, withdrawal method. So they go in, out, in, out, in, out. Before they ejaculate, they withdraw the penis so that the semen doesn't go into the vagina. That is called coitus interruptus, called the withdrawal method. The withdrawal method is used a lot by people who do not believe in using the barrier methods. For instance, people who are Catholics. So some Catholics I know of, they believe is against their religion. So they are actually choosing coitus interruptus. The other way is rhythm method. So the rhythm method is when you are tracking your ovulation and you are only choosing to have sex during the times when you are not fertile, when you are not ovulating. So these are natural methods. Then there's the artificial or barrier methods. Okay, the permanent ones will be the vasectomy, where you cut the vas deferens, so that the sperm does not get released when the person ejaculates. Tuberculomy is you're doing it to the person with the vagina, so you're tying her tubes so that the egg doesn't get released. Okay, then there's temporary methods, which I mentioned just now. There's the condom, there's the diaphragm, there's putting the gel, the spermicidal gel, which I mentioned just now, is not actually very good for the body. Actually can cause irritation for people who are sensitive like me. Then there's combined. You can use more than one method. You can be on the pill, and then you can also be using the condom. You can use the IUD, you know, the copper thing that I mentioned, and then you can take different kinds of pills, injections, and you can also have what they call post-coital pills. Post-coital pills are also known as emergency pill. So this is when maybe you forgot your barrier, then you get very, very worried, then you want to prevent pregnancy, so you take it after, or maybe you during sex the condom broke or something, you know, something happened, you realize afterwards the condom broke, so you may want to take the pill after sex. So this is post-conceptional. So this is just a cheat sheet to show you all the different methods. However, the most popular is still the external condom, or what they know as the male condom. So in this chart, it shows the different efficiency of the different methods that I mentioned. So just now I mentioned rhythm method. So this is similar to this fertility awareness method. Okay, so this is another name for it, but more or less it's actually the rhythm method. So now I want to talk a little bit about the misconceptions around people with disabilities. People with physical disabilities should have the same choices around preventive health measures for STIs and other conditions. So condoms should be used. Those who have been sexually active, women should have a regular pap smear to help prevent cervical cancer. People with disabilities should participate in immunization programs, like for instance, the human papillomavirus vaccine that I mentioned to you just now. It can help prevent cervical cancer, but it can also help prevent human papillomavirus for people with penises. So it can help prevent genital warts. Women need to understand the importance of being aware of how their breasts look and feel, and should be encouraged to see their doctor if they notice anything unusual. Okay, so regardless of abilities or disabilities, we need to notice what is happening in our bodies as we age, as we go through our life stages. What is normal discharge? What is normal breast feeling? Touch yourself, explore your own body, get to know yourself. Women aged 50 and above may want to consider going for mammogram so that they can have early detection of breast cancer. So mammogram is something that you are advised to do once a year if you are above 50. For me, my mom had breast cancer, so I actually started going for mammograms yearly when I was very young. Okay, so what about people with penises? They need to understand that if they notice anything unusual about their bodies, whether a lump or anything around their testicles, you can also go for a checkup. Okay, now this next thing that I'm covering is about condoms, male condoms, okay, or external condoms. So they can last a very long time, but always check the expiry date. And when you open it, a lot of people use their teeth, but be careful, because you may be in your excitement, you may actually damage the condom. When you put on the condom, you take out the condom from the packaging, make sure it can roll down. It can roll down. So first you might want to test with your fingers. Is it rolling down properly on your fingers? Then on the erect penis, you pinch the tip, and then you put it on the tip of the penis, and then you roll the condom down. If you want, you can put lubricant inside the tip of the condom, but actually all condoms are lubricated, so it's entirely up to you. You can use a water-based lubricant or silicone lubricant inside the condom or outside the condom. Then you have sex. Step number 5. After you ejaculate, right, you hold on to the brim of the condom. So you pull your penis out, you hold on to the brim. So make sure there's no spillage, and then you take it out of your body very slowly. You may want to tie a knot so that the semen doesn't spill out from the condom. And one thing is, do not flush the condom down the toilet bowl. Do not flush it down the toilet bowl. Maybe you will feel shy about disposing your condom. You can put it with some tissue to cover it, but don't flush it down the toilet, because it can actually cause blockage in your toilet system. Yeah. Okay, here are some pictures to show you some possible sex positions. And I mean, we are thinking in mind like of people who may have some physical disabilities. They may want a position that is more comfortable for them. So this can include your partner being on the edge of the bed or table, and then the other person kind of like kneeling a little bit so that they have more easy access. So you don't have to be completely on your knees on the bed. And then there's face to face. So if the person is on the wheelchair, you can sit on the person, whether it's a wheelchair or a chair. You can sit on their penis. You can sit upright instead of being on a chair. You can do side-by-side penetration. They call it spooning. So imagine what a big spoon, small spoon is like in the cabinet, the drawers. So one person is kind of like curled up and then the other person is behind. You can have modified doggy position with a chair or wheelchair. So you can get support from tables. You can get a few pillows to position yourself so that you feel more comfortable. And there are such devices out there like sex furniture, but the most common is pillow. And it does make a huge difference whether you use a firm or soft pillow, whether your pillow is high enough. It may take you a while to figure out like what will help you to feel more comfortable. Because when you're uncomfortable, this is when you may go into pain very quickly. And people who experience pain, they may have difficulties to get or sustain their erection. Then there's a 69. So this is when both your mouths are on each other's genitals. So they call it 69 position.